Hello, I'm Noreen Assad, the Community Relations Associate at University House Issaquah. Before we start today's presentation, I would like to share a little bit about our beautiful community. University House Issaquah is a premier retirement community located near the foothills of the Cascade Mountains, where our residents enjoy access to nearby Issaquah shopping centers, as well as beautiful views of the Issaquah Alps and the year-round natural beauty of our two courtyard gardens. We are honored to be partnered with the University of Washington Retired Association, which gives our residents access to classes through UW's Osher Lifelong Learning Institute. Our residents share a passion for knowledge, art, and culture, and a desire to remain active in mind, body, and spirit. If you'd like to learn more, please give us a call at 425-557-4200. And now on to our main event. We are honored to host Karen Nelson, who will be presenting on Medicare 101. Karen has worked in the Medicare insurance industry since 2012 and has her life and disability insurance license in Washington, Oregon, and Idaho. Karen was an inaugural board member on the Humana Broker Advisory Council and is a member of the Senior Care Coalition, as well as multiple other senior advocacy groups. Karen, you may take from here.
Thank you so much. Appreciate that introduction. Good morning, everyone. Welcome to this little chat, Medicare 101. I'm going to take a guess that most people here on the call are on Medicare. There might be a couple that are not as of yet. I'm going to take Medicare, even if you've been on it for a long time. There are some things that most people really aren't aware of. So I'm going to break it down. We're going to talk about the different parts of Medicare. We're going to talk about the different insurances that you might want to put in place to go along with your Medicare. We're going to talk about some time frames as to when you might make some changes. And hopefully you'll walk away from this conversation learning a little bit more and being able to empower yourself a little bit with a little more information and know-how. So I'm going to take a second here. I like to just get on right in there with the actual source, and that's Medicare. So I'm going to share my screen and see if I can't get you to see what I see. Let's see if this works. First try. Voila. Can you see what I see? Do you see the Medicare and You book in front of you? If I can get some not. Oh, I have a thumbs up from Tina. Anyone else nod of a head that you can see it as well? Okay. Oh, thanks, Savannah. I appreciate that. Okay, so we're going to talk right out of the official Medicare and You. You can, if you don't get this book in the mail, most folks will receive a copy of this in the mail. If you do not, and you would like to get a copy of it, you can always call Medicare. That number's 1-800-MEDICARE, very easy. Or you can go to medicare.gov. Always make sure if you're trying to go to the official website for Medicare, you are going to medicare.gov because it is a government website. There are too many websites out there that have Medicare in the name. I think it should be illegal, but no one ever asked my opinion. So always make sure that you're going to the medicare.gov, medicare.gov website to go to the official one. So I'm going to do a little scroll down here and I'll pass the little fine print on the contents here. And we're going to go to page 4. Let me bring this back down a little bit. What are the parts of Medicare? So we're going to break it down. So you have Medicare Part A, Part B, and Part D. And a few years ago, or a handful of years ago, they decided to create a Part C. So we're going to talk about all of those. So when you first transition onto Medicare, for most people, when you very first transition onto Medicare, you'll have your Medicare Part A and your Part B, okay? Different timeframes to get both Part A and Part B. A typical person, if you're turning 65 and do not have any other health insurance, you're going to transition onto Medicare and you would apply for your Medicare Part A and your Part B benefit. Or if you've been working and you've had that work insurance, but now it's time for retirement, you're going to transition onto Medicare, you're going to have your Part A and your Part B. So let's talk about the two of them. So Part A, it's a misnomer when somebody tells you that Part A is free. That irritates me. Part A is not free. You've actually paid for it, provided that you've worked 40 quarters, the equivalent of 10 years. You've already paid into the system for Medicare Part A. So you have paid for it. When you transition onto Medicare, Medicare Part A will not come at a cost for you, provided you've worked, as I said, 40 quarters or the equivalent of 10 years. Okay. Now, Part A is what we refer to it as your hospital insurance. So when you get admitted to the hospital, you would be using your Part A benefit. So it also covers some skilled nursing, some hospice care, and home health care. Okay. Part B, we say the medical insurance, or sometimes people will say your doctors. Okay. Part B, when you transition onto Medicare, now Part B does have a monthly cost to you. Right now, that cost is right about $150. Okay. And you will pay that monthly when you're on to Medicare, whether or not you have any other insurance in place, or no matter how much you're paying for your other insurance, you're always going to have to pay that Part B premium. It is income based. So if you are having a very high income, Medicare is going to charge you extra for it. If you are very low income or no income, you might get state assistance to pay for your Part B. But everyone who is on Medicare, you have your Part A, you have your Part B. And as I said, Part B, your medical insurance, it's services from your doctors or other healthcare providers. So it could be a physical therapist that's going to be billed under Part B. Your outpatient care from a hospital, your home health is in there. Durable medical equipment is billed underneath Part B, like wheelchairs, walkers, hospital beds. And then there's preventative services that are also billed under Part B. So you have the two different parts, Part A, Part B. So when you go and have any type of services done, and it's billed to Medicare, there's all the coding and all the fun stuff in there to know whether or not it's going to fall under your Part A or your Part B benefit. When you have the two together, a little bit of a misnomer to say you have 80% of your coverage when you have Part A and B. You kind of have 80% of coverage. There's actually deductibles with Part A and a deductible with Part B. And after those deductibles are met, then you would have an 80% of coverage. Part A, Medicare Part A deductible is per benefit period. Okay, that is not an annual benefit. That amount is about $1,400. And what happens is when you get admitted to the hospital, you now have that deductible that you're facing. Okay. Now, you may or may not have an insurance plan to help cover that. If you have an insurance plan that helps cover that, maybe you've been in the hospital a number of times, you've never seen that deductible, and that's probably because the insurance company has paid it for you, and you weren't even aware that it was there. But for folks that don't have any insurance, they could be charged that $1,400 plus deductible before they now sit in the bracket of that 80% being covered by their Part A, and then they would have to pay that remaining 20%. Medicare Part B also has a deductible, but that deductible is an annual deductible. So once that deductible is met during the year, then you're good to go, and you do have your 80-20 rule with your Part B. That Part A deductible, like I said, it's per benefit period. So if you go into the hospital and get admitted, and 6 months later in the year, you go back to the hospital, you could get charged that deductible again. Okay. Unfortunately, it could be charged to you a handful of different times in the year if you are not protected with an insurance plan. So Part A and Part B, hospital and doctor's portion. And again, once those deductibles are met, you've got about 80% of your coverage taken care of. Then there's Part D. Part D is your drug coverage. And there's a couple different ways to receive your Part D, drug coverage. Part D, you do not apply to, or excuse me, let me go back a step. Part A and Part B of Medicare, when you are transitioning onto Medicare, you transition and you go through Social Security in order to get your Part A and Part B in place. Okay, you can call Social Security. Back years ago, you used to be able to just go right on into the Social Security office. Nowadays, they reference you to ssa.gov. So the Social Security Administration's website, also a government website. So you always have to remember the government at the end. So ssa.gov to get your Part A and your Part B started. But a lot of people get confused because you can't trigger your Part D that way. Well, that's because Part D is an individual insurance company, okay? Part Ds are through the private insurance agency or insurance companies. You can get your Part D as a standalone prescription drug plan, okay? We call it just a PDP. Medicare loves acronyms. And for Part D, it could be, you could have just a PDP, a standalone prescription drug plan. Or you could have your Part D incorporated with another insurance plan, a Medicare Advantage plan, which we'll talk about here in a minute. When you're transitioning onto Medicare and you're trying to figure out your Part D, if you're going to get a standalone Part D to have that drug coverage, the only way to shop for the best plan for you is through Medicare. If you're working with an agent, all of us agents go right through Medicare. Put your medications as you're taking them currently in the system, and the algorithm will spit out to us and let us know which is the best Part D, which Part D is going to be better for you. I just noticed it up at the chat. There's a couple of questions, and before I move too much further, I do want to go back to this real quick. What was the memory word for Part B? The catch word that we typically use when we're, if this is the answer to the question, you're going to have to let me know. We usually say Part A, hospitalization, and Part B, doctors or medical. So let me know if that was the answer to that. Does durable medical equipment equate a CPAP? Yes, it does. Yep, CPAP is considered durable medical equipment. And could I go over the deductibles for A and B? I did that. So if you want me to go through it further on later on, I can certainly do that. I'm not sure if that question came up before I talked about it or after. So, and whoever that was, looks like Glenn. Glenn, feel free to write in there and let me know if I answered what it was you wanted. Okay, hang on a second. Did I lose you all? Oh, hang on one second. My computer's doing something funny. Let me come out of the chat. There we go. Okay, sorry, I apologize for that. Okay. So your Part D, let's go back and talk about Part D real quick. As I said, in order to find the right Part D for you, you want to be able to utilize the Medicare's website. If you're working with a reputable agent, they're going to use Medicare. You could use it as well. Okay, you could call Medicare up and tell them, these are my medications I take. Could you let me know what's going to be the best Part D for me for this coming year? You could also go to the website yourself. And again, that's medicare.gov. And there's a system in there that you could insert. You could put in all your medications the way that you take them. They're going to ask you for your dosage and frequency. And then once you hit that algorithm, you hit the buttons as to which preferred pharmacies you might have, it will spit out and let you know what's going to be the strongest drug plan for your coverage for the next year. Part D drug plans are contractual, okay? They start in January, they end December 31st. So we get into the contracts mid-year when we're either turning 65 or we're retiring, or you can get into a Part D this time of year, which is the annual enrollment period. Okay, so anybody can get on any type of Part D that they want to during this time frame. You can put that application in, and that plan is going to start for you January 1. Okay, once you get into that contract, you are in that contract for a full year. So the snapshot of medications that you may be taking that we can see right now in November, we put that application in. Sometimes those medications that you're taking will change throughout the year. Well, you're going to be on that particular drug plan throughout the year, unless we can trigger what's known as a SEP, a special election period, in order to get you out of that plan. And we'll talk about SEPs a little bit later. But again, prescription drug plan, it's done by the individual insurance company. You shop for it, putting your medications into Medicare Part D, and it's a contractual plan. So you're on it for the year. Okay. Those prices will range, just so that you know, with the drug plans, they are going to vary from one year to another. This year in 2021, our lowest drug plan that we have available in the state of Washington is $6 and change. For 2022, that rate has gone up a little bit at $7 and change. But a really good example for everyone to know that these plans change from year to year. 3 years ago, we did not have a drug plan available to anyone in the state of Washington that was under $10. So through the years, things will change. Drug plans will change. They will lower premiums, they will raise premiums, they will change their formulary. And a formulary is the way that they look at that medication, where they put that medication on the grid, basically. So a tier 1 or tier 2 medications are going to be very inexpensive, very low copays, possibly no copays. Tiers 3, 4, and 5 are going to be your more expensive medications, your brands, maybe your chemotherapy medications and such. Okay. Questions on any of that before I move forward? And give everybody a minute. Oh, I see a question. Who sets the tiers? Good question. Who sets the tiers? The individual insurance companies set the tiers, and they do that utilizing pharmacists, utilizing doctors. There's a lot of behind the scenes. These are contracts. And so there's a lot of people that are working to put all of that information together. So there's a lot of different hands in the pot creating those tiers. They look at the usage from the previous year. They look at stats as they are, and they create the tiers. So tiers are going to be different for every single carrier. And that can be very tricky. But again, that's why we use that algorithm that Medicare has. Because just because a medication that you have with one plan is a tier 2 medication does not mean it's going to represent a tier 2 medication on another plan. Okay. So it's always hard when I hear somebody say, oh, that medication is really cheap, I don't pay for it. So, might be that way today, might not be that way next year on the current plan or on a different plan that you choose. Okay. This time of year is it's really important for people just to kind of look over what you have and look at the contract for the next year and make sure it's suitable for yourself for the next year. Okay, I'm going to move up here. We're going to look at your Medicare options. Let me scroll down here just a smidge. There we go. Okay, we're going to talk about the 2 different ways to actually utilize Medicare's coverage. Okay, there's the original Medicare. And then there's Medicare Advantage, which, as I said, we're going to talk about C, is also known as Part C. So let's talk about original Medicare first. Original Medicare is when you have your Medicare card, Part A and Part B, and you have a separate Part D. So you have a standalone prescription drug plan. And then you have supplemental coverage, or what's known as a Medigap plan. Okay, I'm going to bring this up just a little bit here so that you can see this better. So you have Medicare Part A, Part B, a separate prescription drug plan, and a Medigap plan, which means that you're going to have 3 different cards if you are on original Medicare. When you go in to see a doctor or you go into the hospital, you're going to show them your Medicare card, you're going to show them your Medigap card, and then when you go to the pharmacy, you'll show your Part D card. So when you have this particular strategy, Medicare is the one who's going to say yes or no to any services that you have. And Medicare's rule of thumb is if it's medically necessary, you get to have that service. So when you go into the doctors and the doctor says, oh, I think you should go see a cardiologist, then you get to go see that cardiologist. You don't have to ask permission as to which cardiologist you go to. Typically, our doctors will give us a referral to someone just because they want to be aware of where it is that you're going. But if you decide, oh, I don't like the name of that cardiologist, I'd like to go see this one, or my friend has a good cardiologist and I'd like to go. When you have original Medicare, you're able to do that. You don't have to ask any permissions. If the doctor recommends you to have an MRI, you get to go and have that MRI. There isn't anybody who's checking to see if you're authorized to have that MRI. Okay. As long as it's medically necessary, you get to have it. Now, typically folks don't just decide they're going to go have an MRI on their own. And when you go to make that appointment, they're going to ask you who your physician is. So you do kind of have to make sure that you're doing what the doctor is expecting you to do. However, you don't have anybody who's calling that insurance company and asking if it's authorized for you to do that. Okay. You're in the driver's seat in a way when you have original Medicare, because like I said, you don't have to ask permission. You don't have a primary physician who's giving you referrals to go see your specialists. If you go to see a specialist and you've decided you want a second opinion, you can go and do that second opinion without asking anyone's permission. But an interesting rule that I learned, because I learn as I go, several years ago, I had a client who had going in for a really major surgery. She was really concerned. She saw a specialist. She went and saw a second specialist. She wanted a second opinion, and she decided she wanted a third. Well, I'm glad she asked first. We did the reach out with Medicare, and come to find out that Medicare will pay for a third specialist if you'd like to go see one, but only if the first and the second opinions differ. If the first opinion and the second opinion are the same and you want a third opinion, you'll have to pay for that out of pocket yourself. I thought that was kind of an interesting thing to share. So your Part A, your Part B, Medicare is that primary. They're the ones that say, yes, you can have that service, or no, you cannot. When you have that Medigap plan, that insurance plan that comes in and pays the remaining costs that Medicare does not, they're not the ones who are saying that that's a covered service or not. That's kind of a misnomer for people on original Medicare, because they have that insurance plan and they might receive a bill and the insurance plan may have denied a claim. Well, the only reason a Medigap plan will deny a claim is if Medicare has denied a claim. So when that happens, the very first thing is to look at the service itself to find out, does Medicare cover that service? And if they do, it's probably a coding problem with your provider, okay? Because Medicare is the one who decides whether or not that service is covered. You can also always go to medicare.gov, type in that service that you're going to have, and it will let you know whether or not that's a covered service. And it'll also let you know if it's going to be covered under Part A or Part B. It's kind of interesting if you want to geek out like I do. So again, you're going to have Part A, Part B, you're going to have that Medigap plan. All right, it's an insurance plan, okay? I know Medicare can be confusing because we have Part A, Part B, Part D. And when it comes to Medigap plans, as I said, they're plans and they're also letter plans, so it can be confusing. So the norm that you're going to find with anybody having a Medigap plan, you're going to see an F plan as in Frank, a G plan as in Gopher, and an N plan as in Nancy. Now, there are some other letters in there, but those are the main ones that people will have. They're going to vary in cost as they vary a little bit in coverage. Just so you know, the going rate for the top plan right now on average runs about $200 a month. Now, don't forget that Part B is a monthly charge to you. And that Part B, as we said, is about $150 a month. So now when you have that Medigap plan and now you're paying about $200 more or less for that Medigap plan, it can become kind of expensive. Also, you have your Part D, and that Part D premium monthly cost that you'll pay is going to vary on the needs of that you have. So your Part D, as we said, is going to vary. Could be coming up next year, $7 and change. It could go up to $100 depending on the needs that you have with your medications. Okay, so there's something I always like to share. The state of Washington, Medicare in itself is a federal program. So we have federal guidelines with Medicare. Those Medigap plans are federally mandated. So no matter where it is you are, that plan, if you have an F plan, F is in Frank, it's the same plan here in our state as it is in any other state. Okay, so if you're traveling and you're going from here or traveling down to Idaho or going to Arizona or flying back east, your insurance, your Medicare and your Medigap plan is going to work the same here in Washington as it will in any other state that you go to. Okay, those are federally mandated plans. But as I said, Medicare is a federal program. We also have state rules and we have insurance carrier rules. So there's a number of different things we have to look at. I always like to share that in the state of Washington, we have a very, very unique rule that no one else in the state has. And that is that your Medigap plan can be changed at any point in time in the year if you want to change to a different Medigap plan. Now, why would you want to do that? Well, our insurance commissioner is very consumer friendly and recommends that you shop around your Medigap plan for a price. Because as we said, an F plan is an F plan is an F plan. It doesn't matter what your carrier is, the coverage is going to be the same. But just like going to the grocery store and you might pick up a can of Dole peaches, in one store it's going to cost one amount, in another store it will cost another. And that's true with your Medigap plans. So where somebody could be paying $300 a month, somebody else could be paying $220. And that's a significant difference. So any time of the year, you can change your Medigap plan to go from one Medigap plan to another. Can't change that Part D anytime you want to, but you can change your Medigap plan here in the state of Washington. Okay, so Medigap plans go along with original Medicare. They're, again, original Medicare is that they're the ones that say yes or no to your services. You can use those from in this state and any other state. If you travel outside of the states, no matter what Medicare plan you have, we always recommend that you get travel insurance. There's one plan that does have some emergency foreign travel in it, but I still recommend all of my folks, if you're going to travel outside of the states, to get a travel insurance plan. Okay. When you're in original Medicare, typically a lot of people, they like those plans because if they're seeing a doctor a lot, they're going in and out of the hospital, they have certain diagnoses, they're really medically using that plan. Folks find original Medicare to be very easy to work, okay? Because again, you're in the driver's seat. You're not checking to see if somebody accepts your insurance. You're just saying, okay, do you take Medicare? Great, I get to go and do what I need to do, okay? It's also nice for some folks, they like to budget. It's going to cost them a little bit more, but they know what their medical needs are throughout the month. Let me see a couple questions here. You said get travel insurance. Are you talking about a private travel insurance plan? Yes. And as far as cruise ship, I don't know. I can't answer that. I just let everybody know that when you travel outside of the United States, you might want to pick up a travel plan. They're not very expensive. I don't sell them myself, so I don't say that so that I can make some money. I have a few folks I can refer you to if you need it, but it's just the rule of thumb in the world of Medicare. Okay. All right, let's move on to Medicare Part C, or Medicare Advantage plans. And I am sure if any of you on this call have watched TV in the last, I don't know, 6 to 8 weeks, you've seen the commercials for the Medicare Part C's, the Medicare Advantage plans. Okay, you're still going to have your Medicare Part A, you're still going to have your Medicare Part B, and most plans include a Part D. A and B and D together, some wise soul said it equals Part C. So Medicare Advantage plans are also known as Part C. So Medicare Advantage plans, you still have those parts, but now your Medicare, it's not Medicare who's saying, yes, you can have this service, or no, you can't. It's the individual insurance carrier that you have your Medicare Advantage plan with. So you could have a plan with Humana, you could have a plan with United Healthcare, could be Premera, could be Aetna. There's lots of plans out there, lots of insurance carriers that offer these Medicare Advantage plans. There's pros and cons to them, so we're going to talk about that. So Medicare Advantage plans are contractual plans, just like a standalone prescription drug plan, okay? And there's a variety of things that we look at in order to find the right Medicare Advantage plan for you. These Medicare Advantage plans all still have to follow certain guidelines with Medicare. There are certain services that they have to offer, but they can also offer some extra benefits. And you can see it's noted there that most plans include a Part D and some extra benefits with these plans, because again, they're done by the individual insurance company. So they like to entice you to utilize their plans for business purposes. I'm going to glance at this really quick. Okay. The question is, could a Medicare Advantage plan deny? And I don't always stop at those chats or to those questions, but I really do like that because I want to make sure that I do answer what it is. So Medicare Advantage, let me take a step back. Yes, Medicare Advantage plans are managed by the individual insurance carrier. Could they deny a service? It is true that they could deny a service. In my almost 10 years in this industry, I've had one client that has had a service denied by her Medicare Advantage plan. I use it as an example because it's a completely and totally out of the box surgery. It's not anything within the norm. She's had a challenge for many years. Every doctor she's ever gone to has told her, no, there is no surgery that's going to solve her problem. She did find one doctor who said that they would, and the Medicare Advantage plan denied her having that surgery. She's the only person I've ever had. And she wants to blame that particular insurance carrier, but we can't be promised that any other would actually allow her to have that service. One person in 10 years that I know of has ever had anything denied. And again, it's an out of the box situation. So it is a misnomer, or people say, oh, I have cancer and they're not going to, because I'm on Medicare, they're going to deny it. That's not true. Okay. It's not true. I don't want anybody to ever think that those insurance carriers are out there to deny the services, because that's not the case. But they are the ones that are going to manage the care. So they are the ones that are going to do those approvals. So there's typically a little bit of a time frame, because they are having to make sure that they've got the approval for the service in which you're going to have. That could be an hour time frame. It could be the next day. But just know with Medicare Advantage, that is how it works. Okay. So Medicare Advantage, one of the things that a lot of people like about Medicare Advantage, it's the price right off the bat. And if you've seen the commercials, you can see that Medicare Advantage plans, a lot of them will say that they have a zero premium. So there is no cost to you up front for those plans. Medicare Advantage are pay as you go plans. So they are plans that as you are utilizing the plan, you are receiving services, you will pay typically a cost share amount on those plans. So if you're not going into the doctor a whole lot, you're not utilizing, you're not going in and having those MRIs or long hospital stays, you're not going to be paying a lot of money. But if you are using your plan, if you do have to have that MRI or you do have to have a hospital stay, you will have cost share. Again, these plans, they're not all at a zero premium, but most of them are very low up front, and again, pay as you use them. And they have those extra benefits on there. So these are the type of plans that are going to have extra dental, extra vision, maybe some foot care, variety of different things on these plans to entice you over. They are contracted plans. So again, if you want to get into a Medicare Advantage plan, again, during your turning 65 timeframe or your retirement, you can get into the contracted plan, or during this time of year, during AEP, you can get yourself into a Medicare Advantage plan. Let's see, Medicare. Oh, let me see before I go to my next thought. Just saw something pop up. Is it true that Medigap policies all deny for pre-existing conditions of kidney disease? There are some rules with ESRD, and those have changed. Off the top of my head, I cannot remember the exact with those changes. So if somebody has a question on that, I can talk to you later. We can do the lookup really quick if you need to, because certain plans will cover end-stage renal disease and others will not. Okay, so Medicare Advantage plans, again, those are a pay-as-you-go plan. So a lot of these plans, they've gotten better and better. They're stronger and stronger as the years have progressed. But how do you determine which is going to be the best one for you? Because you've seen all the commercials and they all sound really good. Well, there's a variety of different things you have to look at with these plans. Because they're contracted plans, providers are contracted in with that plan. So you want to look and see what your network looks like. Okay, how many doctors, what hospitals, what, does the plan that I have is Polyclinic in network, is Virginia Mason in network, is Swedish in network, and the networks are going to be different between each of the carriers. Okay, so you want to look at what your network is. You want to look at what your doctor accepts. Make sure your doctor is in network. Sometimes people will change their doctor in order to stay on a certain Medicare Advantage plan. And other times people will say, I only want to get a plan that my doctor accepts. You want to look at how your medications land on the formulary, because just like standalone prescription drug plans, Medicare Advantage plans, all of the formularies are going to be different between the carriers. You want to look at utilization. Something as an agent, what we do, we go through every single year, this time of year, we look at all of the new contracts. We look at what the upfront cost is, and then we look at the cost of these plans throughout utilization. What are your copays going to be? What is your cost share going to be if you're actually using the plan? And then we also look at what the extra benefits are. Some of these plans will include transportation. Some will include an over-the-counter catalog. Some of them will include the dental benefits, and they can vary from one carrier to another. So, as an agent, when we look at this, because we were looking at that big picture, some of us have some that we really do think are a little bit of a stronger plan than others. But as an agent, we're not allowed to tell you that one is better than another. We're not allowed to use the word best. We're not allowed to specifically call out one particular over another. I always make sure when I do these talks, I never discuss which carriers that I have preferences to, because of that utilization. I always try to keep that, just to those folks that I work with. Medicare Advantage plans, we're finding, like I said, that they're stronger and stronger as the years go on. And the reason why is because these Medicare Advantage plans have proven that they're saving dollars in the world of Medicare. They're saving. So again, everybody's paying into that Part B, and Medicare is paying out, but they like to see, okay, where is it that we can be cost effective? Well, these Medicare Advantage plans are considered wellness plans. They want to get you in the doctor. They want to take a look and see whether or not there's something going on, because they want to try to keep you out of the hospital. Because they have operated the way they have, and they've shown that they're able to save Medicare the dollars, they get more money funneled into the plans, and the plans become stronger and stronger as the years go by. So another reason to look during this time of year to see, okay, what plans are available. There's new plans coming in every year. We had a really great one with United Healthcare come in last year. It's a little stronger this year. Humana's come out with a new plan this year. That's really good. We've seen a carrier that's never done a standard Medicare plan come in and offered a standard plan this year. So things are new and ever evolving and ever changing every single year. And it's really advisable to take a look at what you have and make sure that that's going to be the plan you want for the next year. So let's talk about, if we have any questions on the Part C, grazed on it a little bit, but I want to talk about the timeframes to make some changes. I'll wait just a second, see if anybody has a question there. Okay. This time of year is really important for you to look at whether or not you're on that original Medicare structure with your standalone Part D, or you're looking at your Medicare Advantage plan. Because again, like I said, things change every year. We had a carrier for a number of years with a Medicare Advantage plan, was a zero premium plan, and 1 year they put a premium on it. And if folks just assumed that they were not going to have a premium and they got the bill in January, it was kind of a shock. Well, that's because people don't really pay attention to those mails that come in. If you're on a plan, whether it's a Part D or a Medicare Advantage plan, you always get something in the mail referencing what the changes are going to be for the next year. Okay. Evidence of coverage is one of the pieces of mail that you'll get. You're always going to get something that'll say if you have a particular drug and it was on a tier level, the company has to let you know that that tier may have changed the next year. If you're going to have a premium change, the carrier always has to let you know that. The problem is a lot of times we are so overwhelmed with the amount of mail that we do get that we kind of sometimes miss the important things. But it's really a value to be looking at what you have, look at what those changes are, and then make a change for yourself if you feel you need to do so. So this time of year is called the annual enrollment period. So this is the time to look at your standalone prescription drug plan. Is it the right one for me for next year? Should I make a change? My Medicare Advantage plan, do I want to stay where I'm at? Do I want to change to a different carrier? Maybe I'm on original Medicare and my premiums have gotten really high and I want to try my luck with the Medicare Advantage plan. It's a great opportunity for you to do that. And same thing, vice versa. Sometimes folks are on a Medicare Advantage plan and they're finding that it's become a little more expensive for them, or they've had a doctor change, or there's a variety of factors. Maybe they want to move over to original Medicare, and you can do so. Okay, the state of Washington, like I said, we have rules here in Washington and we have carrier rules in Washington that allow us to do a lot of things that some other states we can't do. So you can change back and forth as many times as you want to between October 15th and December 7th. But the last thing Medicare sees in the system, December 7th at midnight, is that plan that you're going to have January 1. Okay. The month of January, February, and March is another enrollment timeframe. It's called open enrollment. Gets a little confusing, but in open enrollment, anyone on a Medicare Advantage plan can make a one-time change. You can change to a different Medicare Advantage plan, or you can move over to original Medicare if you'd like to. Okay, as we said, October 15th through December 7th, your change takes effect for January 1. But in January, if you want to change that Medicare Advantage plan, anytime in January, the change would be effective February 1, February would be March 1, and March 1 would be April 1. So you have a nice time frame on Medicare Advantage to make a change if you want to. Okay, that's a big misnomer for people. They think once they're in there, they're stuck for life. You're not. You do have that other opportunity to change. That rule was kind of changed around and recreated a few years ago. So again, Medicare always changes. So it's always advisable to look and see, okay, what's going on now? I talked briefly about an SEP, a special election period. And that's a time frame. There's a variety of different SEPs that Medicare will allow us to make a change to your plan mid-year. So it could be the fact that you've moved from one state to another. It could be that you've moved from one part of the state to another part of the state. The plan that you were on is not accepted in this new area in which that you live. You can change from Medicare Advantage to original Medicare January through March. Yes, you can. If you're on a Medicare Advantage plan and you want to move to original Medicare, you can do so. So when you transition onto original Medicare, you put a Medigap plan and you put a Part D in place. That Part D will automatically kick out your Medicare Advantage plan. Okay. When you've changed from one Medicare Advantage plan to a different one, or that Medicare standalone prescription drug plan, you do not have to call the Medicare Advantage that you're on currently. They will get notified automatically through Medicare. But a Medigap plan, if you change your Medigap plan, you do have to notify the carrier. Okay, that can get a little confusing. I recommend talking to an agent about that. But so special election period, you know, moving is a special election period. Another one that it's really important for people to know, if you end up in the hospital and then you go into a skilled nursing or go into some rehab, you have another time duration in order to change your plan. Medicare gives you 2 months to make a change if you'd like to. And that's got value because sometimes that hospital stay has now really affected your health, may have affected the medications you're taking and your game plan in the future. So to take a look and make a change to your Medicare plan could be of value to you. There's a variety of other special election periods. When you have always been on a Medigap plan, I have a client doing this right now. She's always been on a Medicare, she's always been on a Medigap plan, always had original Medicare, always had a Medigap plan. But this year she's decided she wants to try her luck with a Medicare Advantage plan. Well, the nice thing Medicare does is what's referred to as a trial period, trial rights. So she has an entire year to try out that Medicare Advantage plan. So anytime within the year in 2022, if she decides she doesn't like it, wants to move back to original Medicare, we can put that back in place for her. Some carriers will give you a 2-year rule. So what I tell my folks, I think it's really important that you always ask the question. Okay, you always want to ask the question, do I have availability to make a change? Sometimes that answer is going to be yes. And sometimes that answer is going to be, you might not be able to change now, but you can change later in the future. Okay, asking the question is a value. Okay, I see somebody's screen has stopped. Oh, now she's moving. I was just checking to see if it was me or if it was another individual. So, and again, there's a lot of different SEPs. It has, Medicare has made some really good changes a couple of years ago. They had some wording in there that was very, very tricky. It made it a big challenge in order to change some plans, but they finally gotten with the program, and we've got some really good opportunities to make a change, special election periods if we need to. I do my darndest. If somebody really needs to make a change out of a plan, I'll do everything I can to try to figure out if I can create an SEP for them. Sometimes we get lucky. Okay, any questions? I've given you a lot of information. I feel like I've kind of completely overwhelmed here. I see a lot of ahead, yes. Did you, Any questions on anything there? I don't want to overwhelm and have heads explode there. Oh, you're muted. So if you want to say something, can you unmute? Or, okay. Oh, there is a question in the chat. Can you please explain again the deductible for Part A and Part B? Sure. Okay. Part A's deductible is per benefit period. It takes place when you get admitted to the hospital. Okay. So when you get admitted to the hospital, you have that Part A deductible, and it's 90 days, I think, is the benefit period. I don't remember right off the top of my head. I'm in another state and have a medical emergency. Will Medicare or Medicare Advantage pay? That is going to, okay, hang on. Let me get to that one. Let me finish the Part A and B deductibles, and then I'll jump to that one. If you've got your Medigap plan in place, Medigap plans are going to vary. And because of the unfortunate increase in cost of Medigap plans, a lot of people are looking at plans that are not the standard or typical, as I should say, F, G, or N plan. People are starting to look at some of the other plans. I'm a firm believer, if I'm writing a plan, a Medigap plan for anyone, I always want to make sure Part A is covered. I don't want somebody to have to pay 50% of it. I don't want somebody to have to pay 75% of it. It is a huge value to me to get someone to understand that those Medigap plans, it's really, really important to have Part A covered for you. The Part B deductible is minimal. It's an annual deductible. They always get triggered in January because January through December is that timeline that we look at. So if you've paid your Part B deductible for 2021, you're going to have to pay it for 2022, depending on what plan you're on. It will start again in January. Okay. One, again, our A is $1,400 and change and can come at you multiple times if you get admitted to the hospital several different times a year. The Part B deductible is annual, and that is paid when you're seeing your doctor or potentially durable medical equipment or whatever's being billed through Part B. Great. I appreciated that answer. Okay, so let's look at this question here. I'm in another state and I have a medical emergency. Will Medicare or Advantage plan pay? So if you have original Medicare and that Medigap plan, you're going to be covered in the same way. The state that you're in is going to cover the same way in another state. So if you have that medical emergency, your insurance is covering it. Medicare is going to cover it, no problem. The gap is going to pay those remaining costs, just depending on which Medigap plan you're on. Will Medicare Advantage pay? That is going to depend on what it is that's happening and whether or not you are in that networked area, because you could have, say, for an example, a United Healthcare plan here, you're traveling to another state, you're still in network for United Healthcare, your plan's going to pay really well. If you're out of network, there is emergency coverage on said plan, okay? Emergency coverage, and that's going to depend on what that emergency is, what the services that's happening, as to what the Advantage plan will pay. So there is emergency coverage on all Medicare Advantage plans. That's the way that they all work, okay? Hopefully that answers that. And asked, what's the difference between Medigap and Advantage plan? Okay. Big differences. They operate differently. Medigap is the secondary to Medicare. So Medicare pays the allotted amount for the service. The Medigap plan comes in and pays the remaining amount. Okay. Remember, Medicare is the one who says yes or no to the service. Medicare Advantage, it's the Medicare Advantage plan, that individual insurance company who says yes or no to the service. Most plans, your initial doctor's visit on a Medicare Advantage plan, a lot of plans right now are zero cost to go see your primary, because they want to encourage you to get in to go see the doctor. Your specialists are going to have a higher copay to them. Okay. And again, as you're utilizing that Medicare Advantage plan, you're going to have cost share to the services that you have. They operate completely differently. Again, Medicare being, you know, I don't want to say rule maker, but, you know, they're in the driver's seat as far as your coverage is concerned, versus Medicare Advantage is the individual insurance company. I like to say one is a fruit bowl and the other one is a vegetable platter because they're both good for you, but they taste very different and will do different things to your body, right? One is not going to be better than another. There are times where I can work with somebody and I can say, oh, I can totally see that you're going to benefit if you're on an original Medicare and a Medigap plan. And for other folks, I might recommend a Medicare Advantage plan, knowing that just because they're on that now does not mean that they're going to have to stay on that forever. Hopefully that helps. Do you recommend travel insurance if you're on original Medicare and all Medicare? It does not matter because when you're going to another country, your insurance is not going to be the same. So yes, it does not matter if you're on original Medicare or a Medicare Advantage plan. You do need to have some travel insurance of some sort. There's emergency foreign travel on one, possibly two of the Medigap plans, but again, we just don't recommend it. I just don't. Especially for folks that are older. I hate to say it, we reach a certain point in time where we can become a fall risk. Doesn't matter if you're here or you're in another country. Okay, any other questions? Because I've given you a lot. We've talked about a lot. We talked about the differences between original Medicare and Medicare Advantage. We broke down the parts A, B, and D. Talked about the timeframes to change a plan. Why would you want to change a plan? For those of you here in Washington, yay, being in Washington. We do have some really great rules. It is interesting though, I have to tell you, I go to sales conferences and when I talk to, I talk to an insurance carrier and I mention I'm from Washington, I always get the, hey, you're from Washington. Because the insurance commissioner again is very consumer friendly. So he does make things a little bit difficult for some of the carriers, but I see it as an advantage for folks. Okay, I'm going to wrap up here. Again, if there's any other questions or maybe you have a question later, you can always feel free to reach out to the community. They know how to get in touch with me. I had one community I did a talk to. I had several questions come at me at email over the course of a few days. I'm more than happy to answer those questions. So, okay. Thank you so much.
Thank you, Karen. That has been so incredibly informative. Every time I hear you speak, I learn something new. It is absolutely wonderful. And we so appreciate your time and your expertise.
Thank you. Thank you very much.
I will remind everyone that you'll be receiving a request for your feedback. And we'd love it if you can send that back and let us know what you thought about today's talk. And also share any thoughts on future presentations you might like to see from University House Issaquah. We are so looking forward to the time when we can welcome you back into our communities. We miss seeing people. We miss being able to share our fabulous food. And we just feel like it's coming. We just have to be patient. We're going to get there. In the meanwhile, if you have any questions about University House Issaquah, by all means, reach out, give us a call. If you'd like to schedule time to come in and tour, we'd be happy to show you around. And we just really appreciate your time today, everyone. So unless there are any further questions, I think that's it for today, everyone. All right. Well, I'll say goodbye for now. And have a fabulous rest of your day, everyone. Enjoy, stay warm, and enjoy the fall colors.
Thank you so much, Tina.
Bye, everyone.
Bye.
Thank you. Very good.